Good afternoon, and thank you for the invitation. It is my pleasure to present our work titled The Effect of Age on the Severity of Psoriasis. This work was supported by the Daniel Turnberg Travel Fellowship Award. Life expectancy in the UK is rising, and it is estimated that by 2066, 26% of the UK population will be aged 65 and older. However, research on how psoriasis progresses with age is relatively limited. Our study aimed to investigate the natural course of psoriasis with age in the older population. To achieve this, we conducted an online survey among members of the UK Psoriasis Association, aged 65 and older, who had developed psoriasis before the age of 40. Participants rated the severity of their psoriasis on a scale of 0 to 10 and provided information on lifestyle habits, treatments, medications, and associated medical conditions at various life stages, in 20 years intervals from birth till the age of 60, and 5-year intervals from the age of 61 and above to increase sensitivity within the older age group. The survey also included open-ended questions to explore changes in the morphology and distribution of psoriasis over time. A total of 180 participants were included in the final analysis. The median age was 73 years. 56% were male and 44% female. The mean self-rated severity of psoriasis decreased with age, reaching its lowest point in individuals over 80 years old when compared to severity at ages 21 to 40. This reduction remained highly significant across all age categories above 60. Analysis of qualitative data revealed 3 main themes regarding changes in psoriasis with age. First, the severity of psoriasis is reduced over time, characterized by diminished redness, smaller and thinner plaques, reduced scaliness, and itch, which aligns with our quantitative findings. Second, psoriasis distribution changes over time, from widespread to localized disease, with increased involvement of the trunk and decreased involvement of the scalp. This change was sometimes associated with changes in hair growth and may be linked to changes in the hair follicle psoriasis axis. Finally, retirement was identified as an age-related ameliorating factor for psoriasis, likely due to reduced stress levels. In search of predictors of high disease severity at an older age, current severity ratings were categorized as high, meaning ratings of 5 and above, and low. Lower disease severity at an older age was associated with the use of statins, as was found in previous studies. This was also associated with longer disease duration. In contrast, the presence of itch correlated with a higher disease severity at any point during the course of the disease. Interestingly, a history of smoking was associated with lower current severity, though the true impact of this could not be assessed due to the low number of current smokers, and is likely attributed to smoking cessation. Our study's limitations stem from its methodology, including recall and selection bias. In conclusion, these findings indicate that the clinical severity of psoriasis improves with age, particularly after the age of 60, and psoriasis morphology changes over time. This improvement was associated with longer disease duration and may be attributed to the aging of the immune system, immunosenescence. In clinical practice, modifications to systemic treatment regimens in this age group are worth exploring on a case-by-case basis. I would like to thank my colleagues and collaborators on this work, and thank you for your kind attention.
Thank you. Any question?
Stina Callis-Duffin found, I don't know, maybe 15 years ago, that the same thing with smoking. And they never reported it because you don't report that smoking will decrease the severity of psoriasis. But her attitude was it's probably because they're less stressed out.
Thank you.
Nick Reynolds, very nice study. Did you look at BMI?
Yes, BMI was calculated as one of the cofactors in all of the analysis, and we didn't find any significant association, but it is worth mentioning that our median BMI was 25, which is relatively low for psoriasis patients. So it's one of the limitations of our study group.
Yeah, the reason I ask is that as people get older, they tend to get thinner, so it may be a factor.
Thank you.
Question.
Yes.
Any indication that the composition or the distribution of immunocytes in lesions of young psoriatics and old psoriatics is different?
There are some studies on the immunologic phenotypes of older versus younger psoriasis, but I think there are various confounding factors. Mostly the age of onset is very influential on the immunologic phenotype of psoriasis. If it starts at an older age, this is not the population we tested. We tested type 1 psoriasis, meaning before the age of 40, but there are studies on this topic, not ours, though.
Hi, sorry, William Kings. I have just one question. It was very good to see that you have asked about the determinants of aging, but I was wondering, have you looked at certain markers like genetic expression of psoriasis, especially with patients over 60, because, or whether you have catered for the underlying differences, the non-linear decrease in skin genetics when at the peak of 40s and 60s, as one of the paper by Snyder et al. In 2024, just recently, did show that there's a non-linear decrease in the genetic expression. So I was wondering, do you cater for that to look at people over 60s? Because it's quite interesting to see that psoriasis is actually decreasing in severity.
Thank you for the comment. It is very interesting. We did not look at this in this study, but it is worth exploring in future studies, the impacts of this.
Thank you.
Thank you.
Okay, thank you. Thank you so
Thank
much.
you very much.
Okay.